Hi, everyone. Dr. Carolyn here. Today, I'm going to be talking to you about the tyranny of the scale and how to stop it. So, I recently posted something brief on social media about how taking some publicity photos affected my own body image. Now, while I'm aware of all of the movements in the field of eating disorders, whether it be body positivity, body neutrality, fat activism, fat liberation, and so on and so forth, I am still human. And like many of you, probably, I'm aware that it's not easy to like your body when it doesn't conform to societal norms. As I grow older and experience health issues that impact my body size and shape, and just experience the results of working in a very stressful career for many decades, I've had to recommit myself to ignoring those outside voices and refocusing on my own love of and compassion for my body, which, after all, has proved to be so resilient and strong despite all it's gone through, especially over the last couple of years. So I always say that body image has nothing to do with your body. This is something I tell my patients in the Anchor program all the time. Body image issues, preoccupation, or obsession about our body size or shape is really a red herring, or you can call it fake news. What I mean by this is that almost always, when we say we're obsessing about our bodies, what is actually happening is that we are feeling some negative emotions or perhaps having negative thoughts about something completely separate from our bodies. But because these thoughts, these feelings may be unconscious, we instead assume we're feeling bad because of our size or shape. So, for example, when I've been very stressed about something, I often default to thinking I feel bad because of my size or shape. When I step back and think about what preceded my body image issues, it really had nothing to do with my body. Rather, it was all about my stress or about some thought about whether I'm doing a good job at work, for example, that started me obsessing about my body image. I think we've been led to believe that, being hyper focused and obsessive about thinking about our bodies, continuing to beat ourselves up is what works, when in fact, it's just the opposite. Now, scales, the tyranny of the scale is the topic of this video, but scales haven't been around forever, unless you were cattle or farm animals that got weighed on industrial size scales. And I kind of feel like a farm animal when I'm going to the doctor's office and continually being asked to get weighed. But scales only came into existence in 1917. Before that, people just ate what they ate, whatever was available to them, and then they got back to work and back to their lives. And weight wasn't even a part of a person's, health profile. Just imagine what it would be like if you were to walk into a doctor's office and the nurse, instead of saying, "Can I get you on the scale?" they said, "Let me take you to the room and the doctor will be with you soon." So these negative thoughts and feelings about our body lead us to often feel like a failure. And we may think that that's due to a lack of willpower or feel like we're losers. These thoughts come from the underlying root cause, often related to trauma, which makes us think that we're not worthy, unlovable, or unfit. And we can somehow convince ourselves that we're no longer even deserve to have a good life or deserve to have a good relationship or job. And all of this can be triggered by the scale, the tyranny of the scale. So how do you know if you're experiencing the tyranny of the scale? Well, number one, ask yourself these questions. Number one, do you get upset when the number on the scale isn't to your liking, or get happy when it is? Number two, do you negate any non-scale progress you've made when the number on the scale is not to your liking? Number 3, do you feel like you're a failure because you can't seem to change your size? Number 4, does the number on the scale determine your mood for the whole day? And number 5, if you have lost weight by the number on the scale, do you obsess about how to keep that weight off and try to eat and do exactly what you think helped you lose weight? If you answered yes to any of those questions, you may be a victim of the tyranny of the scale. Now, sometimes dissatisfaction with your body can cause you to actually disconnect from it, ignoring body cues, looking only at your face in the mirror, for example, or avoiding looking in mirrors altogether, or avoiding wearing tight clothing, just so that you don't have feelings of distress or dissatisfaction about your body. This also disconnects you from your body sensations, and most importantly, from the wisdom your body has to offer. If you think about it, disconnection from your body may make your attempts to whip your body into shape with excessive or extreme exercise or with painfully restrictive diets easier, but it will make it more difficult for you to maintain a healthy lifestyle, to enjoy eating and moving. Another way in which body disconnection shows up is as an excessive preoccupation with the body through body checking, pinching parts of your body that you're worried about, checking for fatness. In fact, you may be one of over 50% of individuals with, for example, binge eating disorder who engage in regular body checking. Yet another example of how we may obsess about or avoid our body is through either obsessive weighing or avoiding the scale altogether because you're afraid to see that number. And sometimes that's necessary. Sometimes it's helpful to avoid the scale for a while, but it's not for the reason that you're afraid of it. So anyway, as you can see, there's a lot that goes into the tyranny of the scale. Now, I want to just offer you a little homework that you can do, which will help you tap into your body's wisdom. So just put yourself in a comfortable position, either sitting or laying down, and just try to relax your body, taking 3 deep breaths. Imagine the bottoms of your feet are reaching down to the center of the earth, grounding you and calming you. Just allow yourself to let go of any distracting thoughts and allow your body to feel as if it is sinking into the chair and directly connected to the center of the earth. Remember that your body always speaks in kindness, not in meanness or negativity. Your body only wants you to know love, not pain. With that in mind, answer the questions below. Number 1, if you were to listen to your body's wisdom, how would you address your negative body thoughts differently? And just think about that for a moment. What would it be like if you were to, say, interrupt those negative thoughts and speak more kindly towards your body? The second question is, if you were to listen to your body's wisdom, what would it say to you about your current size and shape? And again, remembering that the body always speaks in kindness and love, what would your body be trying to tell you? For example, my body knows that I'm committed to being fit, and I'm on a journey to healing that will benefit my mind, body, and spirit. So I will put that homework in the notes below, so you don't have to keep going back and rewinding the video. I hope this was helpful for you and that you are ready to let go of the tyranny of the scale. And again, that doesn't mean not weighing or weighing every day or when you should weigh. That's up to you. but it does mean not letting your self-evaluation be related to the number on the scale. You're more than that number on the scale. You're better than that number on the scale. You mean more than that number on the scale. So I hope this was helpful. I just want to remind you that we still have the free book available. You can get a free copy either of the ebook or the hard copy of the Food Addiction Recovery Workbook. I pay for the book. You pay for postage or handling fees. I'd like to also ask you to give us a rating on this video and share this info with anyone who you think might benefit or be interested in it. In the next video coming up, I'm going to be talking about what makes me mad about doctors. In other words, we'll be talking about weight stigma and also about internalized weight stigma. I hope this has been helpful. Dr. Carolyn signing off. Thank you for watching.